Dr. Sukumar has traveled more than 18 countries propagating the benefits of Ayurveda. And he is also a trustee in Integrated Cancer Research Hospital. Today, he will share his invaluable insight from his extensive clinical practice and global experience to show us how Ayurveda offers a path to healing. Please join me in giving a warm welcome to Dr. Sukumar. You can start, sir.
Thank you, ma'am. I'll just put on my.
You are not audible.
Can you hear me now, ma'am?
Yes, now fine.
Yeah. So, firstly, welcome everyone on the occasion of National Ayurveda Day. I, Vaidya Sukumar Sardeshmukh from Pune. I welcome you all. I'm very happy and I'm actually also thankful to Healthcare Sector Skill Council for giving me an opportunity to be there on this special day and to present the research and evidence-based work, what we have done in cancer through Ayurveda. So basically today we are going to discuss about what is the prevention of cancer in Ayurveda. So when we are talking about cancer, let me first tell you that cancer is not as a cancer disease given in any Ayurvedic texts or classical text. It has been compared to different diseases and conditions like Arbud, Gulma, and all this type of diseases. So basically, going to the prevention and what perspective Ayurveda has in according to Ayurveda in cancer. Let me first introduce you to our center in Pune. So we are called as Integrated Cancer Center, which is in a small place in Waguli, in Pune, near Pune, in India. We have 117 acres of campus. It is recognized as Center of Excellence by the Ministry of Ayush, Government of India. It is supported by the Department of Atomic Energy for Radiotherapy Department. We are happy and proud that we are the only institute that has been also supported by Tata Trust, especially for Ayurveda and for Panchakarma Hospital for cancer patients, as well as they are also supporting us for the research activities. We are affiliated to the Indian Cancer Society and also we are empaneled under various government schemes for helping out the treatment for cancer patients, especially below the economical line. So basically, this hospital was established in, we started this project in 1993. Till today, we have got more than 15 to 16,000 cases of different types of cancer. You can see that Ratan Tata sir was there, our past president of India, Pratibha Tai Patil was inaugurated this center. We had different collaborations internationally. We recently have a collaboration with St. Petersburg Oncology Department of the government. It is a 1,500 bedded hospital in Russia. We have also presentations all over the world. We were invited for the BRICS in Russia, and also we were invited for the very big conference, national conference by the Ministry of Health, Cebu government of Philippines, recently in Philippines. So when we are talking about cancer and Ayurvedic perspective, as I mentioned earlier, cancer is not mentioned in Ayurvedic text as a single disease. So it can be correlated to different types of diseases or different types of conditions. For example, we can correlate it with modern terminologies like is called as malignant wound, Dushta Arbuda is called as malignant tumors, Dushta Vranashotha is called as malignant edema, can be compared to malignant edema. Dushta Vidradi can be compared to malignant abscess. Dushta Granthi can be compared to malignant nodes. Nadi Vrana can be compared to malignant ulcers, and so on. So there are different types of solid and non-solid tumors that have been told in modern science and already been told in Ayurveda earlier, but not as cancer, but it can be compared to this diseases and conditions which were told more than 5,000 years ago. So what are the causes of cancer? That is very much important. So we have to first see that the improper dietary habits, that is ahara, improper lifestyle, that is vihara, occupational hazards, psychological risk factors, addictions, vices, previous illnesses. If somebody has any previous illness and it has not been cured for a long time, that can be also one of the factor responsible for causing different type of cancers. Hereditary we have seen usually that we also do a preventive analysis, and preventive measures have been taken when especially in the gene mutation or where the hereditary things are there, because we have seen that if a mother is having cancer of the breast, then if she has the daughter may have a risk of getting the same breast cancer in the future. So we try to do the prevention, as well as we try to tell them that why it is important and why it is hereditary also responsible. Also, unnecessary excessive intake of medicines, excessive and frequent use of following food, especially spicy food. According to Ayurveda, all katu, ushna, tikshna, this type of ahara, which has been told like spicy food, green chili, or sour food, that is too much of preserve, where chemicals or preservatives are there, like tomato sauce or vinegar, too much of sweet, like where sugar content is on very high. Also salty food like papad or wafers, hot and spicy food, chili, non-vegetarian food, especially when we are talking about non-vegetarian only, it means that it not should be too much spicy or oily, or you should not eat too much frequently. Also hot and oily food and extremely cold food, also like cold drinks or refrigerated food or chilled water, taking it frequently can be also one of the causative factors. Also heavy to digest food like condensed milk, or we can say fermented dairy products like we can say butter, cheese, food that causes drying, or bakery products, contraindicated food like fruit salads, for example, milk and fruit together, like that, or stale food. The food we usually recommend that should be taken should be warm and well cooked. Food with preservatives like sauce, jam, tin juices, and all this type of food, fermented food, and consecutive intake of hot and cold food together. So also the main thing is that you should not hold your natural urges. So there are many patients who tell us that, oh yeah, we are a little bit holding up our natural urges, like not going to the natural urges frequently, or just holding it in the offices or during the in the working hours. Also sleeping during daytime, which is called as divaswap according to Ayurveda, creates heaviness, ama, kleda, and kapha in the body. Also staying awake till the late night. Also, cancer, which we are talking about, occupation related risk factors, that irregular work hours. Too much irregular work hours. We can see just now that in the IT field also, for example, they are working in the American time, they're not sleeping properly. So there are different irregular work hours that are done. So you should also give your body that rest sufficiently, or it will be one of the risk factors. Strenuous physical work, constant contact with high temperatures, chemical contact with leather industry, or too much exposure or frequent exposure to the radiation X-rays. For the mental causes, irritable, short-tempered nature, anxiety, suspicious, sensitive nature, especially the things that affect the mind, that affect the the manovasrotas, it affects the pranavayu, and that can create mainly the problems mentally and then affecting physically. Then excessive and addictions like tea, coffee, betel leaf, betel nut. We can say that in when we are doing a research in cancer, especially we are based in Maharashtra, so we have got a lot of patients related to the mouth cancers in gents, because from the rural area or from the countryside, we get the patients who usually have the addictions or vices of betel nut, betel leaf, or even tobaccos. So because of that frequent and long duration of intake of this toxins which create in the body of this addictions and vices, that can cause different type of mouth cancer, or buccal mucosa cancer, and or cancer of the cheeks. So that's why this is what we have seen. So you should avoid these things also. Also, due to improper dietary behavior habits, due to hereditary causes in patients, certain body becomes weak. Cancer may occur in said weak body part. For example, if you have previous illnesses and if you try to ignore it, if you try to not follow the improve the systems or improve the conditions or improve the imbalances in the body, then it will cause the different types of cancer in the future. For example, if you have too much of hyperacidity or indigestion and you're ignoring it for many days, like constipation is also there. So you may have a problem with cancer with the gut, especially the stomach, amashaya, the pakwashaya, the colon, small intestines, and esophagus. Also, asthma is there, and you're not treating it properly, or frequent attacks of the cough is there, and you're not treating it properly for long term. Then it can be in the future have a risk of having the cancer of the bronchus or the cancer of the lungs. Same times also menstrual disorders, if you are not correcting it, in especially the ladies, they in the menopause also or in the menstruation, they usually have many menstrual disorders like PCOD, PCOS, and many different types of things. And if they are not correcting it, if they are not doing the treatments properly, if they are ignoring it, so in the future, they may have a risk of getting the cancer of the genital organs, or especially cancer of the uterus, cervix, this type of cancers. According to the classical Ayurvedic text, the formation of body parts is primarily attributed to both parents. Especially, we are talking about heredity and genetics here. So basically, in Ayurveda, there are some organs which are called according to the mother, that is the Matrujha Bhava, and they are formed according to the Matruja Bhava, and specific organs are formed by Pitruja Bhava. For example, skin, liver, spleen, kidney, bladder are Matruja Bhava, and Pitruja Bhava, bones, semen, nails, and teeth. So we should see that, as I told you earlier, that we are also collecting data for the patients who have been registered in our projects for especially hereditary cancers, or for the prevention of the hereditary cancer. For example, the grandmother has a CA breast or a CA cervix or a CA uterus. Can the granddaughter have or the daughter have? So we are also doing their prevention as well as treating them and guiding them if they have such type of gene mutation or hereditary cancers. So what has to be followed? First importance in Ayurveda is given in Dinacharya, the daily regime or the daily lifestyle. I think the most important thing now we have to follow in any of the problems related to the chronic problems. In Ayurveda, cancer, disease, or these different conditions which we see, it is basically related to the imbalances of all the three doshas, mainly affecting and vitiating the body tissues, which are called as dhatus. And destruction of that body tissue starts if you try to ignore them, which is called as dhatu pak avastha. And in such cases, the lifestyle is one of the most important thing that we have to concentrate and improve, especially related to the food habits, sleeping habits, exercise. That is what we have to concentrate. Also in Ayurveda, the most important thing is also in different seasons, there are different proper regime that has to be followed, so that the imbalances in the body, the dosha dushti in the body is not too much aggravated. Also, we have to follow a proper diet regime. We have to follow the rules and regulations of having food, and also the code of conduct is very important, which is also given in Ayurveda. So especially till 12 years, nutritious and healthy diet is very important. After 35 years, we usually recommend that everyone should go through a body purification process at least once in a year or at least once in 2 years, to avoid or to prevent problems getting through different conditions and diseases which affect different organs. Also, following the diet and routine during the child and the birth. After puberty also, it has been given importance, planning childbirth and garbhini paricharya. So I'll not go to this, but let me tell you that Panchakarma is one of the thing that is very much important in Ayurveda. Panchakarma means detoxification processes where you are been cleansing out the body, the imbalances, especially related to Vata, Pitta, Kapha. So Pancha means five and Karma means detoxification processes. So there are different types of cancer that prevention has to be taken. It's a very detailed thing, but let me go towards what Ayurveda says. Uh, Cancer is caused by abnormal growth according to the modern science. What modern science says, just a minute.
Meeting है? Sir, you are not audible.
Yeah, I'm sorry, some network issue. So importance of exercise to prevent cancer, which is already given in Ayurveda. So as we have seen that the food, dinacharya, the lifestyle, the daily regimes, the seasonal regimes has to be followed, and also exercise is one more thing that can help you to prevent the different diseases and problems. So preventive measures, especially through panchakarma. So what panchakarma has the importance and the procedures that has also been given in Ayurveda. As I told you, Panchakarma means there are 5 detoxification processes and which acts on specific dosha in the body to cleanse the vitiated dosha from the body, to reduce the toxins from the body, to reduce the unnecessary waste matter from the body or the blocks which are there in different systems in the body. So that's why Panchakarma should be usually given or taken after the age of 30 to 35, at least once in a year or once in 2 years. So solid, the diet is very important. What diet you should take, as I told you that you should not frequently, we have already seen that what we should not frequently consume, which can relate to the problem with mainly the Agni or the digestive system. And that can be the cause of different types of conditions and diseases. In further, if we ignore that, can have a risk of taking towards the cancer. So this is regarding the diet. Also, we have in our hospital our own kitchen for the patients that we give them the sattvic food. Importance of mental health in cancer is also been told in Ayurveda Sutra. Because when a person gets to know that he has a cancer, it is not a person who mentally gets shattered, but I think the whole families. So we have to here do the counseling sattvajet to make the mind more positive, to tell them the actual status and how Ayurveda or the integrative medicine both can help to improve the quality of life of that patient is much more important. Yoga is one thing that helps definitely. Pranayam is one thing that helps definitely. Music therapy is one thing that helps for the positive mind or reducing the negative thoughts from the body. As I said, your family members, counseling, support groups are there. And in Ayurveda, there are different allied therapies apart from Panchakarma that helps to reduce the mental stress or to reduce the disturbance of the mind. So, for example, Shirodhara is there, Shiropichu is there. So, different types of therapies are also been recommended, which help in improving the mental health in cancer patients. Counseling, as I said, why it helps? Because it is improves coping ability and disease, because we know that this disease is one thing that is very much can be aggressive, and also it is very much can be fatal to different in different chronic stages. Boosting self confidence is also one thing. Positive attitude or healthy family relations. So these are some pictures that we have been showing. So I think this is what we have been talking about, how Ayurveda can help as a perspective in cancer and for prevention in cancer. So I think thank you very much for giving me this opportunity for the Skill Council of India, Skill Sector Council of Health of India. And I'm thankful to Dr. Neha ma'am. She has been talking to us. regularly and correcting us. Thank you very much.
Sir, let me ask the audience some question. If audience has some questions, that's okay. Otherwise, I have little like few
Okay,
one or
okay.
two questions regarding the same.
Please, please, please.
Sir, you
Yes.
told about music therapy. So, how is music therapy related to anti-cancerous thing?
No, actually, music therapy helps in preventing the mental disturbance, especially one, because music is one thing that it is scientifically proved that there are different ragas which are given in music or in Samaveda, where it has been told that these ragas are working on different types of organs also, and also the mind directly for reducing the imbalances of the doshas which are affecting on the mind. So it is also helping to keep you more positive.
Sir, then the
No,
person who is
it
already
is
suffering or just to prevent, who
it
should
is
take?
for both. It is for preventive
Acha, for
also,
prevention also.
and it is also for the person who is suffering. So, for example, if you say that there is a patient with CA brain, okay, the brain, or any cancer with head and neck, where usually we have to take care of the mind as well. So, in such cases, music therapy helps a lot because it helps to generate the positivity in the person. It helps to reduce the it helps to improve the calmness in the person, where the pranavayu or the vata, which is mostly disturbed, helps to get reduced. And in that case, it helps him to get stability and proper confidence. So that is also one positive thing music therapy helps. And we have already conducted a lot of research in music therapy because I would like to. I'm proud to say that my uncle was a shishya of Pandit Ravi Shankar and Annapurna ji playing sitar, and he was one of the person who was doing music therapies on cancer patients, especially in small children also, and in old patients also.
That's too good, great. But sir, nowadays the diet you have shown everybody, one or other is taking such kind of diet. Like, can you tell the audience how to escape from such a diet? How we can avoid such diet?
How we can avoid? Sorry, I didn't hear your question properly. Hello,
Not audible now, please tell.
hello, ma'am. Hello.
Yes,
Sorry,
sir,
ma'am.
बताइए.
I could not hear you properly. Can you ask the? Can you repeat the question, please?
Sir, I'm asking that these days everybody is taking such diet, which you have explained, which is prone to cancer. So how
Right.
can like the public wants to know how you want to
Yeah.
I mean how
So
one should
that
avoid such diet.
Yeah, that is a good question. See that what happens now, whatever the food we are getting every day or we are eating every day, most of it we don't know that it does it have any chemicals or not, right? For example, if you're taking milk also in the morning, which is our daily one of the major food which we are taking, so we don't know is it pure or not. So at least try to get things from pure sources. Try to avoid too much of food that creates more spiciness or creates more preserved food, or which are too much refrigerated food, or which are actually we can say stale food. So at least we can avoid these things. The normal diet with normal timings, or we try to maximally follow the timings of the eating of the lunch and dinner or the foods or the meals. Also try to do exercise, try to have 100 steps which is called as Shatapavali after your meals. Even if you're in the office, even if you're in your working place, you can just walk 100 steps after the lunch or the dinner. I usually do in my clinics. I after my lunch and dinner I have 100 steps walk. So such type of things in the food also, try to avoid too much of contraindicated food, hot and too much frequently, or too much oily food, too much greasy food, too much sugar, or too much uh, food that is made with sugar or sweets. So this kind of thing, if we try to avoid, then it can be a preventive measure in our lifestyle or in our food habits. Is it will help us to at least prevent these things. And as I said, once in a year or once in 2 years, please do the detoxification wherever you are, whoever doctor you have. do the Panchakarma. It will help you definitely for that.
Anybody else has some questions? So thank you so much, sir, for
Thank
such
you,
an
ma'am.
informative webinar today.
Yeah,
It's
ma'am.
really great to have you here today. I must say thanks to you and all the
Thank you,
audience
ma'am. And we will.
for.
I'm also thankful to you. I would.
I think you're
I'm also
getting late,
thankful to
sir,
you.
but we'll
And
connect with you some other day.
hello, hello, ma'am.
Yes, yes, sir.
Thank you. Thanks to you, specially, ma'am, for connecting. And I would like to invite you also, the whole team, to Pune
We'll
sometimes in
come,
the
sir.
future.
We'll definitely come to Pune and we'll visit
We
your
are already
organization.
we are
We are
already
keen to
working
visit.
with yeah we are already working with Maharashtra Skill University, ma'am.
Okay, okay, sir. Nee, sir, we
Thank
will
you, ma'am.
definitely, if we'll be in Pune, we'll definitely come to your organization. If we want to see how you're working,
Please, ma'am. Thank you
So
very
it's,
much. Thanks very much.
thank you for
Thank you,
such
ma'am.
a
Thank you very much.
informative webinar. I know
Thank you
you're
very much,
getting
ma'am.
late. Thank
Thank
you
you.
so much, sir.
Pleasure, ma'am. Thank you very
Okay.
much.